There are a lot of conflicting findings and reports on the effectiveness of annual mammograms. According to the National Cancer Institute, results from randomized clinical trials and other studies show that screening mammography can help reduce the number of deaths from breast cancer among women ages 40 to 74, especially for those over age 50. However, studies to date have not shown a benefit from regular screening mammography in women under age 40 or from baseline screening mammograms taken before age 40. The specialists at Florida Hospital Waterman's Digital Mammography Center note the recommendations of the American Cancer Society and the importance of catching breast cancer early.
When I was in medical school, the incidence of breast cancer was 1 in 10. Now it's 1 in 8. So really need to even be more aware that they follow the protocols like getting your first mammogram at the age of 35 and then from 40 years onward every year. Self-exam is very important because 10 to 15% of breast cancer is not visualized on a mammogram. And I do tell people sometimes they come in with a palpable thing, it turns out to be nothing. I tell them don't keep on touching every day. Do it every month because you'll get paranoid about it. But at the same time, don't neglect it. I know there have been studies saying that mammograms have a limited role in certain things, but I still think that's the best tool we have and it'll help us. There's no excuse not to get a mammogram above the age of 40. It's like when you're covered by the insurance company, you're covered for a screening mammogram. So if that's okay, we see you next year. Diagnostics, they cover a certain portion, but you have to pay the rest. But at that point, you're going to want to know what's going on. See, because what we do is when we read our screening examinations, we do call back about 10% of our patients back. So that's when they get the diagnostic. But 90% get a good report card. And that 10%, when I recommend a biopsy, I tell my patients, only 20% of these turn out to be cancer. The other 80% are benign. So that kind of allays their fears too.
You'll find contact information for Florida Hospital Waterman's Digital Mammography Center as well as links to past stories when you click the Understanding Mammograms story link icon on our homepage, yourhometownhealth.com.